there's so much opportunity every day, Naren, and I want to sort of frame this with a with a goal that I think all of our listeners and all of our listeners' team members will embrace. When we talk about adding same-day dentistry, of course, there are very specific financial benefits to your practice to add dentistry and add treatment into your schedule today. But I want to back up and talk about the benefit to the patient, the benefit to the patient. I like to think that the very best practice model is patient-centric, as opposed to being all about numbers. Naren, does that make sense?
Absolutely, Gary. Yes.
I believe when we're patient-centric, when we really consider what is best for our patient, and that's the driving force. It was William Mayo that said it so well of the famous Mayo Clinic. The best interest of the patient is the only interest to be considered. That was said by William Mayo, the physician of whom Mayo Clinic was named after. We all recognize Mayo Clinic. Naren, even in Canada, do you recognize Mayo Clinic?
Yes, Cleveland Clinic and Mayo Clinic are considered to be the best hospital systems. If you have something life-threatening, then you go to one of those two places.
Absolutely. And William Mayo, who was named after, famously said, the best interest of the patient is the only interest to be considered. So the benefits to the patient in doing same-day dentistry is that we can solve a problem before it becomes more complicated. Is that in the best interest of the patient?
Absolutely, because actually it's kind of interesting. I was talking to a friend of mine who's in healthcare, and they're talking about Canada might go into a two-tier system, just like the US. So there's a private and a public, just because they can't keep up. I mean, the public can't keep up. And one of the things that this gentleman was telling me is a lot of these big corporations like Walmart and Amazon are contracted with clinics like Mayo Clinic or Cleveland Clinic, and they're finding their healthcare costs are going down because these institutions are mostly proactive. They don't wait for the 11th hour to solve a problem.
A crisis,
exactly.
A crisis which could be catastrophic for a patient,
right? And very expensive for whoever is paying the bills. Instead, if you become proactive, your costs actually end up going down. But it just takes a different mindset, different way of thinking, which currently is not how healthcare works.
So for example, dental, let's bring it back to dental. So if we can take care of broken down fillings, but let's say they're asymptomatic, and because they're asymptomatic, the patient doesn't think they need to be done. But if we can take care of it in advance, if that can be a better outcome for the patient instead of waiting until it hurts, because if we wait till it hurts, that treatment may not be able to be treated with just new filling. It might have to be done with a root canal and crown. And that's, more complicated and more advanced for the patient. So this is in the best interest of the patient. But now I'm going to go outside of the clinical benefit, and I want to talk about also what's in the best interest of the patient. Naren, we haven't talked about this ahead of time, so if you get it wrong, you can call a friend. I'll be your friend. What is everyone's most valuable asset? Every person's on the planet, what is their most valuable asset?
What is their most valuable asset? Time.
Right? Time.
Yeah, time. Yeah.
And so if we can save them a trip and get it taken care of today while they're here, are we serving our patient?
100%.
Now, does that just apply to, say, executives? Like the executive that, it's very expensive for them to, make another visit on another day to come to the office because they're not able to work. Does it just apply to them, or does it apply to everybody?
Applies to everyone. Everyone who has a job, I would obviously say, I don't want to come back if I can get it done today. Even moms or anybody who's doesn't have a full-time job, but rather doing other things around the house and taking care of the family. Even they would
stay-at-home parents. Stay-at-home parents, absolutely. Their time is as precious. I might argue they're even more precious in terms of time.
Yeah, because they're juggling quite a few things. So, if they can avoid a trip, why not?
Right. Absolutely.